Well, we know that supervised consumption services are not a silver bullet, but they are a critical component of a comprehensive strategy to deal with drugs. They reduce the risk of infectious diseases, importantly reduce the risk of overdose deaths, really important in terms of connecting people to services, social services, healthcare services, and critically important, they are a really humanized approach to dealing with this issue, which is an addiction.
I support supervised consumption sites for the reasons that it gives a safe environment, non-judgmental, and it also opens opportunity for other services that they may need or want.
If you'd asked me a few years ago, I wouldn't have been terribly supportive, but I think we have to get our head out of the sand and be a little bit more flexible because of the rate of overdose death we're seeing with this poison drug supply. I think we have to have novel approaches to treatment and get over ourselves in terms of very rigid rules about addiction treatment and start to finally do what we said we want to do to meet people where they are.
Supervised consumption services are part of a total community safety web that looks at crime prevention, and it starts with individuals and businesses. What can you do to make your place safe? It starts with individuals making individual choices, and it mashes out into us not trying to stigmatize and criminalize addictions, homelessness, and mental illness, package that up and call it crime.
Supervised consumption services will help not only people in distress, but will also help the perception of the downtown. As a business owner, I know that for some people coming downtown, they're uncomfortable seeing the needles on the street and people hanging around. But for me, it breaks my heart knowing that these are real people that are struggling and that it could be any one of us that end up in that situation.
Our illicit drug market is incredibly toxic. This is what's killing people. It's not substance use in and of itself that's killing our community members, is that the drug supply is more toxic than ever. This isn't looking to change anytime soon. So the least that we can do as a community is provide a place where people can consume drugs, toxic as they may be, with someone there that's ready to respond should someone happen to overdose.
I support supervised consumption services because they've allowed me and my family members to have relationships that otherwise would have never been possible for us. For that, I'm really grateful, and I changed my mind on these kind of services because I saw firsthand what they could do for us. And I went to school. I got an education in the health sciences, and I see the benefits of them, and for that I'm really grateful for them.
I think we need SCS in Sudbury is because there's a lot of active drugs going on here in Sudbury. We are a main drop-off from either east, west, north, and south. Drugs coming in, they're all different types of drugs, and they're getting harder and they're getting worse for people because people are overdosing in Sudbury because of the hard drugs that are coming in. And we really do need it because it would save a lot of lives.
We need supervised consumption services in Sudbury because people are dying. And the ability to provide this particular service means that members of our community, these folks are somebody's child, somebody's parent, they need to be supported in whatever they're doing. And so this site will allow them to connect with people who can help them.
Well, as a former addict, I would have appreciated to have a place like a safe consumption site to use in. There are a lot of homeless, addicted people on the street in Sudbury that need access to health services as well as clean equipment and a safe place to use.